Hi, everyone. I'm Kathy Pike, President and CEO at One Mind at Work, and it's my pleasure to welcome you all to our first briefing about the Mental Health at Work Index and our quarterly roundtable. Today, we're really excited to be discussing the data that have been generated by the first cohort of participants in the Mental Health at Work Index. And really our passion at One Mind at Work, our commitment at One Mind at Work is to bring research to best practice for real impact. That's what today's discussion is all about. The title for our roundtable, this webinar, is From Measurement to Action, New Findings on Workplace Mental Health. We'll share with you learnings from the data around the Mental Health at Work Index and how you can use science to inform your best practice. And we brought in 3 organizational leaders who have joined me today. They're leaders who are really moving forward to have the impact that they want to have around mental health at work by taking these data, by merging it with best practice to have real impact in their workplace. This mission is really personal and professional for me. I've spent my entire career as a clinical psychologist, a researcher holding academic appointments at Columbia University and also in Tokyo, Japan at Keio University and Temple University in Japan. And I've seen too many times that research gets generated, good research that has real potential to improve the human condition, but it never gets put into practice. So our commitment at One Mind at Work is to start with the science, anchor our work in the science, but not stop there. We're committed to translating this science into practice, working with partners in the real world, so that in fact we can improve mental health in the workplace, something that is especially urgent today. We know that workforce mental health is at an all-time low, and with the big picture global issues that are occurring from environment to violence and war in various places in the world, the burden on our workforce in terms of maintaining mental health is really huge. And so as organizational leaders, we're called on to effectively address the whole continuum of mental health. So let's jump into the discussion and get started. As we begin, I want to highlight that the Mental Health at Work Index that we're going to talk about was developed in partnership with Craig Moss, our partner at Ethisphere, and with the support and partnership of the Mental Health and Work Design Lab at Columbia University. We're going to share some aggregated global data, and then you'll hear from our organizational leaders about their experience in engaging with the index and understand how they're using the results to take action. So I'm joined today, I'm really delighted to be joined by an expert panel to help bring this conversation to life. Virginia Peddicord is Director of Global Wellbeing Resources at Bain & Company. Her department specializes in advising and empowering Bain employees to work sustainably. Stephen Massey, who is the co-founder and CEO of Meteorite, an organization that has founded numerous coalitions between business, government, health, and policy institutions. And Sondra David, who serves as the Chief Human Resources Officer for North Mississippi Health Services, where she manages recruitment, retention, education, and benefits for the organization's employees. 3 really different organizations. I hope that each of them will share with you a little bit about the context of their organizations, but all 3 having participated in the Mental Health at Work Index and taking the findings forward. Let me share with you a little bit about who you all are. We have over 150 people registered for this webinar. And in terms of organizational size, there's a distribution of organizations from 0 to 50 workers, employees, representing about 20% of you, all the way up to organizations with 50,000 and more employees, and pretty evenly distributed across the continuum. We also asked you all as you registered where you are in your mental health strategy. And less than half of you reported having a mental health strategy, about 40%. So that's going to be a big piece where we'll start, and it'll be interesting to hear from our participants about what does it mean to build a comprehensive mental health strategy. For those of you who, whether or not you have a mental health strategy, your responses around how you are engaging around mental health were pretty evenly distributed also, in terms of being very early, just getting started, representing just over a quarter of you, about another quarter who have ad hoc programs and resources in place, but don't really have all the pieces put together in a coherent whole. About another quarter that has some standardized operational practices, but without a coherent overarching strategy. And then about 15 to 20% moving forward in terms of advancing systematically and engaging in continuous quality improvement. So sort of a whole continuum of where you are organizationally in terms of your mental health at work practices. As we get started, what I'd like to do is present to you some of the framework of the Mental Health at Work Index and some key findings, and then bring our panelists in to talk about their own experiences and observations and work going forward. So if we could pull up the slides that I could share then with the group about the Mental Health at Work Index. For some of you who are on this webinar have actually completed the index, so this will be familiar to you, but the vast majority of people on the webinar have not. So I want to give you this overall framework about how we think of how you get smarter about mental health at work. What is this index? It's a self-assessment. It's the first of its kind that is designed for organizational leaders, for decision makers who are leading the work, who can sponsor the work, who can mandate within an organization the vision around mental health at work within the organization. But to do that, you need to know what you're doing and have a systematic framework so that you can strategically deploy resources. We know that organizations are spending a lot of energy thinking about, concerned about the mental health of the workforce. We know from employee surveys that workforce mental health is at an all-time low. What we don't know, what doesn't exist or hasn't existed until the Mental Health at Work Index, is a comprehensive science-based strategy assessment that leaders can use to assess and improve what you're doing in the workplace. And that's really what you have control over, right? The data that you get about your employees is essentially an outcome data. It's like finding out that your child has a fever, right? Then you got to do something, but you need to figure out, what does the fever mean? And what can I do that's going to have an impact on this particular condition? So the index takes us upstream organizationally to say, let's take a scientific framework and put in the hands of decision makers a tool to self-assess what it is that you're doing and where are you in terms of maturity in your mental health at work programs. Once you complete the assessment, it's about a 65-question assessment. You receive pretty much immediately, 15 minutes later or so, your scores, a comprehensive report of all of your responses, and then a summarized report that provides your overall score for the entire assessment, and then your score by category, which I'll share with you in a minute. It also provides for you benchmark scores of all the organizations that have completed the assessment to date. So how do you compare to peer organizations? And it provides you a reference of a target score of what good looks like based on the existing science and best practice. We don't stop there. So you get these scores. Now, what do? You get in your report a set of priorities that help you decide where to get started and how to get started. And a resource library. The advice library has a whole host of materials for you to use to inform your strategies for improvement. And then additionally, we conduct an expert review call with you and help you synthesize the report further and brainstorm your roadmap for improvement. So the framework for this assessment is what we call the 3 Ps of protection, promotion, and provision. It goes across the entire continuum of mental health. We think this is really important. The data tell us it's really important because you can't just focus on one piece of this continuum and expect to have overall improvement in terms of your workforce mental health. You need to begin with a big picture of how are you protecting the mental health of your workforce? How do you eliminate hazards that could negatively impact the mental health of your workforce? Then you need to also be thinking about how do you promote mental health? How do you create organizational structures and systems that promote mental health for your workforce? And also, how do you promote mental health skills and knowledge and resilience and resources individually within your workers? And then third is the provision. Provision is about providing access to information, resources, services. That's the area that's sort of been the bread and butter of mental health at work for a long time. And for a long time, there's been so much stigma about actually accessing those resources that are provided. There's been very low uptake, very low utilization, or very late in the game utilization. People wait a long time before they would take advantage of the resources and services. It results in significant inefficiencies in terms of strategy because we know that when people wait longer, costs are greater, outcomes are worse. And so going upstream and building an organizational culture, an environment where we protect and promote and build a workplace where it is okay to talk about mental health, where there's greater understanding about mental health, where there's organizational and individual capacity to address mental health more effectively, we have better use of resources across this continuum of protection, promotion, and provision. So across that continuum, we look at 10 categories of functioning within an organization. Mental health strategy, big picture, really important because it articulates for your organization how does this fit into your overall organizational strategy, and where should we be expending resources in a strategic way and in a comprehensive way that makes sense for our organization. Additionally, then we look at leadership. How engaged is your leadership in addressing mental health at work, in communicating, in modeling mental health at work? As much as leadership matters, workforce involvement and engagement matters, because we know that this is not a top-down strategy only, but also we need leadership. It needs to matter at a leadership level, but it needs to take shape and be informed by the entire workforce. And when the workforce is involved and engaged in producing and developing what we're going to do about how we do our work and build our mental health programs, they're much better outcomes. Communications, key piece of how we talk about mental health at work, how we advance mental health at work. Workforce involvement and engagement, communications, training specific to mental health at work, and work design and environment all come together to impact our organizational culture and how organizations actually function and support around mental health. Mental health resources and benefits are traditional, as I said, the core component of providing affordable, accessible, appropriate, culturally informed services and resources when and where needed. Related employment practices. There are a lot of things in the workplace, a lot of policies and practices in the workplace that don't immediately look like they are mental health policies or practices, but they have a huge impact on our mental health. And especially, we can highlight here, for example, strategies around diversity, equity, and inclusion. DEI and mental health are very much interconnected. And then we put all of this together and say, how are you doing? Help you assess how well you're doing at assessing, at measuring, monitoring, and reporting what you're doing. It's very hard to make the case for investing resources in mental health at work if you're not measuring, monitoring, and reporting to know what the impact is and what the benefits are, and whether, in fact, you should keep doing a certain program or whether it's not having the impact you want to have. So the measuring, monitoring, and reporting is a key piece. 3 key learnings that we want to highlight today. And again, I want to emphasize that this is our first quarterly brief and webinar. These are some high-level learnings that we want to share with you all. Our plan is to have a quarterly review as the database grows and as we have new learnings that emerge. So the first learning is that it's very clear that companies are expending significant sums of money and are focused on mental health care and services, but most organizations don't have a comprehensive mental health strategy. So highlighting here, 3/4 of respondents say that they include provision of care, right? Resources, that's the third P. And that makes sense. A lot of that is mandated by law in the US and in many parts of the world. So organizations are most mature in terms of the provision of resources and benefits, at least the ability to provide resources and benefits, even though they aren't so well utilized if you don't have the other 2 Ps in place. Less than 6 in 10 report including promotion of psychological well-being in their strategy. So again, not quite half, but about 40% are not addressing promotion, not building resilience, not building systemic capacity, making structural changes within their organization, or, for example, training for managers on mental health, not doing that. And less than half are focused on protection in a systematic way as part of their mental health strategy. So thinking about how does our workplace how do we organize ourselves? How do we reduce the risks in a workplace that negatively impact our workers? How do we help individuals develop the capacities to protect their own mental health? Less than half of organizations are doing this. So across the 3 Ps, we see this declining capacity in terms of focus. That's the first learning. The second learning is that organizations are reactive, right? There are a lot of organizations that are describing an event that occurs in the workplace or in the world. For many organizations, that was the pandemic, where they, in response, develop a program or develop some intervention. But these reactive and ad hoc approaches to workplace mental health exhaust resources, and they don't have the overall impact, the global impact that organizations hope to have in terms of enhancing positive mental health and resilience in the workforce, because they wind up being one-off events or isolated events. So for example, here data points to highlight from our first quarter. Only a quarter of respondents, 25%, assess the effectiveness of their mental health efforts to eliminate hazards and to minimize risks, if in fact they are measuring them, right? So less than a quarter. 40% are measuring and monitoring efforts to promote mental health. So even if they're doing a training program for managers around mental health awareness, they're not measuring, monitoring, and reporting on the impact of those programs, 40%. And just over half indicate that they're measuring the impact and data that's generated related to access of resource benefits and services. So what that's telling us is that there's lots of ad hoc reactive efforts that are not getting well integrated or documented in a way that's going to have the long-term impact that we hope for in terms of enhancing mental health. And in fact, we hear that from organizational leaders time and again. You know, we're doing more and more, but we're not seeing an impact. And in large part, that these data help explain why the impact is not emerging. The third learning is that the data indicate that employers really need to focus more on systems solutions that support all workers across the continuum of mental health needs. I mentioned that early. We know that when organizations focus on protection and promotion, they create an organizational culture where individuals, when they have acute mental health needs, they're more likely to seek resources appropriately and in a timely way, which results in lower absenteeism, lower presenteeism, lower disability, and more effective, appropriate, and efficient use of actual resources. What's happening at a specific level, as I said, less than only 1 in 4, 25% of organizations actually have a formal strategy for workforce mental health. 1 in 3 or less, just under 1 in 3, have an organizational commitment at the level of senior leaders, where leaders are holding their direct reports, or managers are being held accountable to address mental health in the workplace. That's a really critical data point, because managers, supervisors play an outsized role in terms of the impact of work on their teams, right? So supervisors, managers, their capacity to address mental health in the workplace is really critical for overall organizational capacity. But in fact, less than 1 in 3 organizations is preparing managers sufficiently and holding them accountable, making it an integrated piece of their work. And less than a quarter of respondents at organizations tell us that they're sharing their workforce mental health data from their workforce mental health programs with boards and governance members. That's a really, really critical data point. If mental health at work is having, we know the impact that it's having in the workplace. We know that workplaces are expending significant efforts focusing on mental health at work and trying to support workers' mental health. If data are not being generated and the evidence about those interventions are not moving up to the senior leadership, including the governance bodies, it will be extremely difficult over time to sustain the effort and to grow appropriately the programs that are having real impact. and to garner the support that's needed from leadership. So let me stop here and invite my colleagues to turn these data points into real stories, and what you've done, how you've used the index, what your findings have shown us. I think just to start, I'd like to invite each of you to take a turn to introduce yourself and your engagement with the index, and an observation about the data that I've just shared, maybe one brief reaction and how it relates to your own experience. And maybe we could start here, Ginny, with your leadership at Bain.
Sure. Thanks so much, Kathy, for all of that. As Kathy said, I am Virginia Peddicord. I'm the Director for Global Wellbeing Resources at Bain. If you're not familiar with Bain, Bain is one of the world's top consulting companies, management consulting firms, and we've been around for a while. We're celebrating our 50th anniversary just this year. We have grown to about 20,000 employees, and we call them Bainies. We're all Bainies here. Once a Bainie, always a Bainie. And we are a global company across 65 cities, 40 countries. And our average age of our population is relatively young. My team and I, we are charged with enabling Bain to prioritize well-being. And we're also charged with fostering a best-in-class, holistic well-being culture. And we call this effort BEST. And we also have the recognition that well-being is a proven strategic lever that is essential for our people and our business, and our people to be their very best. We are also proud that we have consistently ranked high on Fortune's magazine and Glassdoor's Best Place to Work year after year. And this last year, we were very excited to be one of the recipients of the Excellence in Global Health and Wellbeing from the Business Group on Health. So given that our team is charged with fostering a best-in-class well-being-centric culture, we really value working with companies such as One Mind at Work. And when I learned about the index, I was super excited to bring that back. We want to learn all that we can to get to our mission of being that best in class, having that best in class well-being culture. And we know from our data that mental health is an area of need for our organization. And we do a lot of things, and we wanted to see what we were doing well and what were things that we could enhance on. And we had some ideas as to what those things would be, but it was great to have the information that came down from One Mind, from the best practices. So when you asked about, was I surprised with the data that you just shared? No. One of the things that was identified for us, even though we scored quite high on many of the components, one of the glaring things that we were without was a strategy that dealt with mental health. And so when you talked about only 1 in 4, 25% have that, that did not surprise me in the least.
Yeah. Thanks, Ginny. And Stephen, let's hear from you, and as co-founder and CEO at Meteorite, a very different kind of organization. So,
yeah. Well, first of all, Kathy, thank you so much for the opportunity to be here today. And I'm delighted to be participating alongside Ginny and Sondra, two leaders at really respectable organizations on the cutting edge of mental health. Meteorite is a different kind of organization. We are a small company. We are 21 or so members on our team. We are 100% remote, spread out all over the US. we work to build business coalitions on social issues. And so our team is working with employers every day on issues related to our democracy and civic engagement, and on issues related to health and wellness in the workplace. One of those initiatives that we lead is called the Health Action Alliance, which is an initiative that was created by my team in partnership with the CDC Foundation, the Ad Council, and Business Roundtable during the pandemic to help bridge gaps between business and public health. And one of the areas we've really leaned in is on workplace mental health. And so I'll say that as my team at Meteorite approached the opportunity to take the index and assess for ourselves how we were scoring on mental health in the workplace, I think we approached it pretty confident that we would score at a high level, that there wasn't much more that we could know. And what I think we really discovered was that there was a lot that we could really learn from the process. And I am participating today with some humility, in so much as saying that we scored pretty well on the index, but it, like Ginny, what you said, it surfaced for us some pretty glaring gaps in our own workplace mental health program. As a small company, we, I think, like Ginny, didn't have a comprehensive mental health strategy. I'm proud that we have a mental health policy within our kind of employee handbook, and that was something that we built last year with our team, and it was a very collaborative process to create a mental health policy that reflected feedback from all members of our team. I think we were really excited to launch a mental health employee resource group, the first ERG in our company, and that is an active group. There are important components of a mental health strategy that we have, including offering mental health days, self-care kits, access to a really strong EAP. We do lots of check-ins with our team. We create space for conversations about mental health, but none of that was really captured in a comprehensive strategy. And we weren't really measuring the impact of our programming over time. And so, I think it's just, as a leader of this organization, what I'm really struck by is that it's really hard to manage what you don't measure. And the index created an opportunity for our team to really actually create a benchmark for ourselves and understand where we are right now and identify some spaces where we could improve. So, for us, creating a comprehensive strategy is something that is now has surfaced as a real need within our organization, not just creating that, but getting feedback from our team as we build that strategy and then communicating that strategy clearly to the entire team. In other words, shifting from a more informal system of bits and pieces of a mental health program into a comprehensive approach. I also think that the index really surfaced for us the need for manager training. I think at a leadership level, we've done a great job highlighting the importance of mental wellness and creating safe space for employees to talk to us about what they may be feeling or issues around burnout or fatigue in the workplace. But we haven't trained managers at all levels of our organization to hold those kinds of conversations. And so that's a second area where I think that we need to be doing some work. And then I think, more broadly, we want to be tracking our progress over time. And the index provides that kind of intellectual rigor for us to be able to say, look, here's where we are today, and here's where we want to be a year from now. And so, in all three of those areas, I've been really impressed by the valuable insights that our team got back, including people on our team who are really experts in workplace mental health. We all learned something here at Meteorite from going through this process. I just want to commend Kathy. I know you were instrumental in making this index reality, and it's just a tremendous amount of work that's gone into a product that, in fact, delivers real results for any sized organization at any part of their journey toward creating a mentally healthier, psychologically safer workplace.
Thanks so much, Stephen. One of the things that comes to mind as you're talking about your experience that I want to underscore, Meteorite being a much smaller organization than Bain. And we hear from
organizations, a little bit.
Yeah, sometimes that, we're really small and it's informal. And there are two things about that I just want to highlight, which one is it's really great in small organizations, the what happens in terms of interpersonal connection and in the informality can really nourish and nurture the team. But the thing to be aware of, and I'm sure this resonates for you, when the environment isn't working for someone, in fact, it's very, very difficult because it's a small team and a small organization, and it's very hard if there aren't systems in place, especially when you've got a small organization. So thinking with you about this idea of moving from informal to more formalized systems is really jumps out for me. And the other was that you all jumped in with a relatively small number of employees, and we tried to convey to organizations that this instrument will provide information whether you've got 20 people or 20,000 people. Like, you'll be able to use it in the way that's appropriate for you. So really appreciate the difference in size and the global versus domestic natures of the differences between Bain and Meteorite. I just want to pull those out, and thank you both for talking about your experience. And then, of course, healthcare is another ball of wax altogether, right, Sondra?
Yes.
We know that the issues around mental health for our healthcare workforce, there are huge issues. It's real in the US, and actually it's real at a global level. The pressures and the stresses and the burnout and the mental health issues that are have been exacerbated by the pandemic, by recent events in the world, but real issues and real opportunities. So, Sondra, if you could talk about your experience.
Sure. And Kathy, thank you and the team for inviting me to participate in what I feel is probably one of the most important conversations that we can be having in our workplaces today. So I am from North Mississippi Health Services in Tupelo, Mississippi. We are a 7,000 person organization. So we sit between these other two panelists. We have 7 hospitals. We have over 50 sites of care around our region where we provide care for our communities. And so we really have taken this journey from the perspective of our employee experience and the well-being journey. And, you know, I think we had many conversations or listening posts that were telling us that we were using a very fragmented approach, right? What I call very tactical. We might have this or we might have that, and we have EAP, and we have these pieces that come together, but they really were not a strategy. And I think, like Stephen and Jenny, what was very apparent after we took the assessment was that strategy was really such a critical component of that. So to really be impactful, we can continue to do all these things, or we can create this strategy. And so I will say that I did not jump on first to take the assessment. And I think it was just almost a little bit of embarrassment. You know, we're healthcare, we should maybe understand more of this and we should be doing better. But it was really, I then took it as an opportunity to say, okay, we know that we're not the experts, so we need evidence-based science. We need that best practice to help us understand what that looks like so that we can really develop that for our organization. Because again, whether we took the assessment or whether we do anything, the issues are still there, right? Our workforce is still suffering. They carry very heavy loads. And so I think it's incumbent upon us to be intentional. And I think taking the assessment, getting the feedback with open mind, kind of open heart, and saying, you know, we already know that there's lots to deal with. So what can that playbook look like? And that's really, you know, that assessment is really kind of creates a playbook for an organization to create that well-rounded strategy. And so that's what we've really done. Take an open heart, open mind, and say, we are not the experts, but we definitely can create partnerships and have a playbook to help us do that. And then, you know, be very open with our leadership about expectations. So a couple things that surfaced for us was definitely the manager training. Our leaders were asking for that in very different ways. They weren't saying, I need mental health training. They were saying things like, I'm not sure what to do. I don't know how to have this conversation because I think something's going on. So it really surfaced some things for us that I think are fundamental to that strategy, and moved us away from a really tactical, sort of fragmented perspective to something that now makes sense, that we can actually now measure year over year and see, are we making progress, and where are we making progress, and maybe where do we need some more work, right, in some of those areas.
Mm-hmm. Terrific. So I appreciate, Sondra, that you said you held back thinking, well, we should be doing better. Let's wait till we're doing better and then do the assessment. I really want to underscore that, and I applaud you for saying, all right, we're just going to dive in and find out where we are, because in fact, this index is meant to be a tool. It's meant to be a working tool that provides information and guidance and materials and resources to help leaders, people who have to make decisions about these things, make them in a more informed and strategic way. So we don't really care where you land in terms of your maturity, as long as you get on the train, right? And be part of the work, because once you know, and I appreciate your comment too, Sondra, whether you measure it or not, it's happening. So it's sort of better to know what's going on than not know. Just putting our heads in the sand doesn't make it go away. And one of the things that we hear from leaders, or one of the concerns that we hear sometimes is, well, if we measure and then we see that we're not so mature in certain areas, we're going to have to do something, and we're not sure we have the resources or capacity. And I think there are two things about that. It is really important to do an assessment like this so that you can be strategic about deploying resources, right? Because there are limited resources. The index will give you the information that will tell you what to keep doing and maybe what to stop doing, because it's not generating results. But the other thing is, organizations are paying a very high price by not knowing, right? So the other thing that's important and that we will work on and do work on and is generating the data for organizations to understand that there's a huge cost in your organization associated with mental health when it's not addressed. And when it is addressed, there are huge benefits, right? So linking this work to the bigger picture around overall organizational capacity and performance by looking at things like voluntary turnover rates, disability rates, absenteeism. When you consider how much it costs, I just met with somebody who, a professional, very high performing professional, who is leaving her workplace because of mental health issues and the failure of the organization to address them. That departure will cost this organization tens of thousands of dollars. And so thinking about how to spend that money more wisely is really a big piece of what this index is about.
And
So,
Kathy,
Stephen, please.
I thought I'd just jump in too. One of the things that is really great about it is also tells you where you're doing really well. And for those of us that need to justify spending in this space, I was really impressed that during the post-survey consultation with your team really underscored the great things that we're doing at Meteorite. And as a leader, that helps me double down in those areas. Our leadership engagement. We're an all remote organization, as I said earlier, but we really invest in workspace design to make sure that our team members in their home office feel safe and it's ergonomically friendly. And again, that's a pretty small investment on our side, but I think we provide $750 for an employee to outfit their desk in a way that's ergonomically friendly. But what surfaced in the index was that actually made a really big difference for our team members. It is a small investment that we're making that really pays dividends because they feel safe and just physically healthy in their workspace. We also provide financial tools within our organization, knowing that financial stress is one of the leading causes of kind of mental health burden and stress overall. And so, we offer student loan repayment, which is something that we just initiated this year. And the feedback is, hey, that's great, especially for more junior members of our team for whom that type of support is really valuable. And another thing that we learned from you all is that our culture of coaching that we have at Meteorite, where everybody has a professional coach, is an area that where we really excel. And again, I know now as a leader that I want to double down in that space because coaching really makes a difference. And I think, at any level in an organization, if you're able to demonstrate what is working, it'll help you advocate for more resources to invest in that area. And at the same time, identify those spaces where maybe a little bit more investment will help you go the distance.
Yeah. Yeah. Thanks. That's great. And Ginny, you've been at it for a while. You were one of the early adopters. And so you mentioned mental health strategy, realizing that you didn't have a formal mental health strategy. Tell us, what have you done? How did you translate that finding, the resources, the recommendations that we provided into action? Where are you on that journey?
Yeah, we didn't have a mental health strategy. We knew that it was a best practice. And I think having you report that out to us gave us the ammunition to say, this is something that we really need to do. The best organizations are saying that we need to have this. We had a well-being strategy. But there were a lot of things that we were doing that were focused on mental health. And so pulling all those pieces together, using the assessment and the different parameters that it had to pull together like the vision and the goals and the action and then the resources was so helpful. And we've done all that. The other thing that we were able to do is to we're a global team. And as I said before, we have lots of offices with a lot of leaders. So we were able to look at who are the best stakeholders for these different activities, these different objectives that we have, and let's pull them into the process. And so we worked with the chief talent officer, we worked with risk management, global benefits, the regional benefits and the DEI leadership to get their voice in it. And the other thing that we were also able to do is to assign responsibility to each of the objectives within the strategy so that people were held accountable to get those things done. And there is a core team of us that meets, and we're each responsible for different objectives. We meet on a bi-weekly basis to review those things those actions that we are taking to meet those objectives. I'll tell you, it isn't easy. It's complex to build a strategy, and I think right now a lot of things where we're at right now is developing a point of view, developing and researching, what do we have influence over and what can we do in year 1, 2, and 3. And I think it's more of the planning process that's happening right now. And then I see in year 2 and 3, it will be more of implementing that, but it's setting the whole foundation. And it's really helped us to keep on track. I mean, those bi-weekly meetings, there's a lot of things that happen and you get sidetracked, and it helps us to, get things done and to get those metrics that we were talking about.
Terrific. Sondra, you highlighted that findings from your assessment brought to the fore the need to focus more on communication and leadership as priorities. Do you want to share what did you do with that learning and how did that take shape?
Yeah, so, and I'll just a little context, being in healthcare, we already knew that our workforce was struggling, right? Just being in healthcare, COVID definitely exacerbated all that was happening. And we just had a real conversation at Executive Council about the mental well-being of our entire staff, regardless of what their position was. And so it had been something that we'd been talking about. We had tried a couple things, and again, it was very fragmented, and it became very clear that we needed this strategy. So with our partnership with One Mind at Work, we were able then to have access to the, not only that, but have access to the engagement or to the index, and be able to create that framework for how to build our strategy. And so we jumped in really aggressively. Like, we just said, okay, we've got to continue to really work at this and make sure that it's a part of our culture. So we didn't want our mental health strategy to just be an initiative, right? We wanted our mental well-being to be a part of our employee experience. And quite frankly, we want it to differentiate us from other employers around, right? Or other competitors. And we feel like it will, and the things that we've done. And so we also thought about, okay, we live in the South and generations, and sometimes we don't talk about this and we don't want to talk about this. And so how do we normalize that conversation and start in a number of ways with our leadership and with our teammates? So a couple of things that we did, we definitely developed a framework about how we could talk about all of this that was very connected to our employee experience, what we call our employee value proposition. And so what is our culture? How do we talk about these? What are the words that we say? And we had some frameworks within our organization that were already present. So we have a framework called SAS, and this is really about grassroots efforts to make our frontline workers, their jobs easier. And it starts with asking the question, what's your hassle factor? What's something that irritates you? What's a process that doesn't work? So we can stop doing those things and get better, because that work design is so important in our mental health. And so we started at places like that with frameworks that we already had within our system to interconnect now our mental health strategy. So we created a toolkit for leaders too. How do you have these conversations? Some of the questions that deal with our framework have questions like, how are you encouraged to show up as your real self at work? Like, how do you bring your real self to work? How do you like to be recognized? Questions that really don't have any of the words mental health in them, right? But really have very significant impact. So we did that. And then we also jumped in aggressively with training for our leadership. And we did that in a couple of ways. We have leadership development institutes that happen 3 to 4 times a year. We openly talk about that and intentionally talk about mental well-being, our leaders' well-being, right? Not just our staff, because as leadership, we oftentimes forget about ourselves, right? And so those times were to say, what about you? Here's some things we need you to think about for you to be, have this state of mental well-being, and to be able to talk about it about yourself, so that there's also some authenticity and vulnerability, right? As you're having these conversations with your staff. So we were intentional about having those conversations at our leadership development. Our CEO sends out an email every month with just a short conversation. It goes to both leadership and to frontline staff, our teammates, and it's really prompts for the connections to happen. So my CEO, Mr. Spies, he within our executive council takes those 4 questions and we answer those questions. Mm-hmm. So modeling that also has been really important for our leadership. And then we had the pleasure of having Daryl Toll at our last leadership development, again, to really have a conversation about how are you as leaders being authentic and being accountable for having these conversations with your teammates. So we were aggressive. And the next conversation we'll have is this fall. We'll have conversation at our governance boards, where we really lift up this whole idea of this is part of who we are as an organization. It is important, just like financial well-being for our teammates and for our organization. There's parity there. We're not there yet, but we will be. And I think the intentionality of that is really important in making sure that all of those components are looked at in our strategy. And again, I'll say the assessment helps us, right? It provides insight into what a well-rounded strategy looks like. We're not going to be perfect, and it's going to take us several years to get there, but it gives us a roadmap to make sure that we are addressing all 3 of the P's. So, our insights led us to something which was a little bit different than the data we're showing in that we were very strong in protection. So we have SAS, and we have a lot of regulatory things in healthcare that provide a lot of protections. We weren't doing so well in promotion and provision. And so that's really important. How do our teammates know we have all these things if we don't talk about it, right? If we don't promote and talk about the things that we're doing well. So it really has, it has been a journey. It will continue to be a journey. We're in the planning phase for year 2 to really think about, okay, now how do we continue to build that? And then most importantly, measurement. How do we know? So we use our engagement survey. We have some very specific questions that we can gauge. We'll take our assessment again in a couple of months to see where we're at. And then being able to pull out measures for all the benefits and the resources that we have around utilization, and are they being impactful? What do we need to continue, and what do we need to maybe pivot or not do?
Mm-hmm. Terrific. We're getting to the top of the hour, so I want to just ask each of you maybe to share a closing observation and word of advice for those who've joined us for this webinar about the index, about this journey that you've been on. Sondra, how about if you take it away first?
Yeah, I would say don't be like me. Jump in, just do it. Things are happening within your workforce, whether you know it or not. And to Kathy's point, there is a cost to that. There's a cost to the mental health of your teams. There's a cost to the organization. And, the humility of just saying, you know what, we are not the experts, but there are tools that we can use. And so I say, don't hesitate, because I think the longer we wait as an organization to address these, the greater the impact. And oftentimes we might not be able to correct that. And I'll just use an example. Nurses within healthcare have had a significantly tough number of years. They're not leaving our organization. They're leaving the profession. And I really feel like we can do some things to prevent that. And we need to do those things as an organization.
Thank you, Sondra. Stephen.
Yeah, well, first, I just want to say thank you again for the opportunity to be here and for making this investment in developing the index. I think everybody who's on today's webinar is likely a mental health champion. And so, I want to acknowledge all of you that we are living in a people-powered economy. The 80% of the value of the Fortune 500 today is in human capital. And that is a real shift. 50 years ago, 80% of the value of the Fortune 500 was in machinery and inventory and heavy equipment. As our economy has transformed, the need to really prioritize people and their well-being, physical and emotional, has increased. And for leaders on today's call, making this type of an investment to really understand how you can strengthen, protect your human capital, preserve it, and improve its efficiency over time is really critical. So the business case is really clear. And whether you're just getting started or a seasoned leader working in mental health for a long time, I think there's something to be learned from the index. And I'm personally just grateful for having this tool to measure our own progress and learn from this incredible community of mental health champions that are really fighting to improve mental well-being across the private sector. So thank you.
Thanks, Stephen. And Ginny, take us home.
Yeah, I could have said it better myself than Sondra or Stephen said, and I totally agree with their point. So don't wait, take it. Mental health is unfortunately, with our younger generations, I don't see any light at the end of the tunnel for a need to focus on this area. And I think we all need to be prepared. We can't stick our heads in the sand anymore with what's going on. And this definitely puts us on the right track to figure out that strategy, connect the dots, and also to further connect it to the objectives that our businesses are trying to get to. So thank you for everything you do. And I think that the summary call that you all gave to us after we took the assessment, I wanted to record it. I wish I would have recorded it. So for any of you guys that are going to take the assessment, invite as many people as you can to that conversation. It was just invaluable. So thank you.
Well, thank you all for being leaders and joining us today. Reminder to everyone who's joined us that in honor of World Mental Health Day, we have an opportunity for you to take the assessment and take the assessment for free. And if you complete it by a certain date, you'll also get an expert review call, and you'll have those details, I think, in the chat. Please reach out if you have questions. Thanks for caring about mental health at work. Thanks for joining us for today's webinar, and we look forward to continuing the conversation. And thank you to all our panelists.
Thanks, everyone.